and if a few more folks need to trickle in, that is fine. Hello and welcome to our third and final pilot webinar for the CCO System Level Social Emotional Health Metric pilot. We are so excited to have folks here and on today. We're going to be doing a review of the attestation components 3 and 4. So the second half of the attestation we started 2 weeks ago, looking deeply at components 1 and 2. So we'll be covering 3 and 4 and also discussing some of our scoring considerations. So really excited for this conversation today. A reminder that this work is being led by a collaborative of partners. So my name's Elena Rivera and I work for Children's Institute. We are partnering really closely with the Oregon Pediatric Improvement Partnership. So we have Colleen, Lydia, and Katie from OPIP team with us today, as well as the Oregon Health Authority Health Analytics team. And then a consultant, Sarah Samsell, has also contributed to this work. So it's a robust team. Let me see if I can change the slide. Great, there we go. So today our agenda includes doing a refresher on pilot objectives and the attestation overview, giving a deep review of components 3 and 4. Like our last webinar, we'll be doing some polling questions and then having open discussion to hear your insights. That'll be the majority of our time together. And then we'll also be discussing design parameters and some of our scoring considerations, and then looking ahead to closing out the pilot. So a reminder about this metric vision and purpose. Our vision is that children from birth to age 5 and their families have equitable access to services that support their social emotional health and are the best match for their needs. And the reason we have focused so much time and energy into developing this new system level social emotional health metric is because over the last several years, children's early social and emotional health has consistently been lifted up as a priority for our state. Families, providers, and other stakeholders have all really highlighted that social emotional health is a key determinant of school readiness and predictor of long-term health and well-being. And so this is a really crucial area to focus on, and it's one in which we know there's significant room for improvement in Oregon. And so the purpose of the metric is to drive CCOs to address some of the complex factors that impact social emotional health services, as well as address this gap in the existing CCO incentive metric set. And you know that as we dive into our attestation, you're seeing that the activities are really intended to build capacity within CCOs for enhanced services, integration of services, and cross-sector collaboration, as well as using child-level data to guide and inform those system-level activities. We're really intending for this work to lead us on a glide path. So starting with a system level metric and building toward a child level metric. So the 4 components of the attestation are all launched in year 1 of the measure. So CCOs would be reviewing their social emotional health reach data, starting to develop their asset map, launching community engagement activities, and developing an action plan. And then in years 2 through 3, we really deepen those system level activities, all to build capacity to really improve provision of social emotional health services at the child level. And in year 4 is when we're proposing transitioning to a child level metric. So, as I just said, in the first 3 years, we're really proposing that these attestation activities are what are linked to incentive payments. So a CCO would meet this metric based on completing activities in the attestation. improvement on the child level social emotional health reach metric, which we discussed in our first webinar really deeply, looking over that data and those aggregate reports and child level files. Improvement on that metric is not required in the first 3 years of this measure. Now, reviewing and using that data is required, as we heard. That's what component 1 of the attestation is completely focused on. And then the attestation activities are really intended to build CCO capacity to make progress on improving the reach of social emotional health assessments and services. And we're confident in that because we've seen that through improvement pilots and through everything that we've heard from our multi-year stakeholder feedback, that these are the activities that really get us to making child level improvements. And then, of course, we're proposing to transition to a child level metric in year 4, after CCOs have done this really hard, important, and transformative work to build capacity within their networks. So knowing that this is a brand new kind of metric that has a lot of transformative potential, we wanted to be really intentional about how we craft the measure, what activities get included, and what is required of CCOs. And so we've done deep work to engage stakeholders, including families, healthcare and early learning providers, and cross-system leaders, to hear their perspectives and on-the-ground experiences. And then we've also summarized learnings from improvement pilots that have taken place in 13 counties across Oregon. So really a significant work to learn from and build on. And from that engagement and those improvement pilots, we've been able to generate a list of themes of the barriers and opportunities to improving social emotional health, and identified CCO activities that could address those barriers. And that's a lot of what we'll be talking through today. We used design parameters to narrow that set of activities and draft measure specifications, really thinking about what the different levers are. So I think as you hear about each of these 4 components of the attestation, you see the different levers, hopefully, and how they fit together and build on each other. And then that work led us to developing this metric, and now working in collaboration and partnership with you all to review the social emotional health reach data and the attestation metric itself. We have been really fortunate to receive strong support for this metric, both from stakeholders and from decision-making committees, and just wanted to take a moment to highlight that. So the Metrics and Scoring Committee and Health Plan Quality Metrics Committee both endorsed the 4-part measurement strategy that came out of the Health Aspects of Kindergarten Readiness work group back in 2018, of which this metric is one critical part of the 4. We've also been sure to highlight and heard that it really resonates with stakeholders and committees that this metric is aligned with several state priorities. So the governor, the Health Policy Board, the Oregon Health Authority, CCO 2.0, all share priorities around children's health, behavioral health, and health equity. This work is also aligned with addressing some of the findings from the Secretary of State's audit on work that our state really needs to do to improve behavioral health services for children. And it's aligned with progress that's been happening in Oregon with our early learning system. And in particular, we have Raise Up Oregon, an early learning plan, which really calls out needing to improve connections to social emotional health services for kids and families in support of school readiness. We also know and have called out that this metric addresses a long-standing gap in the CCO incentive measure set and health plan quality metrics aligned measure menu. So the gap specifically is around integrated behavioral health for children, specialty behavioral health for children, and opportunities to support billable community-based services. And we know that we're not operating under normal circumstances. We're in the middle of a global pandemic. And at the same time, we believe strongly that this work is feasible and meaningful work for CCOs to be engaging in during the pandemic. And in fact, that focusing on supports for children's social emotional health in the early years will actually aid in pandemic recovery, both in terms of within the health system and within our education system. So given all of this support, we did go back to the Metrics and Scoring Committee at their November meeting to present an update, and they gave us a kind of strong thumbs up to move forward into a pilot phase, which has taken us to where we are today. So though we have been really intentional about our work to develop this metric over the last several years, we are here today with a really critical opportunity to hear input and feedback from CCOs as the intended end users of this metric. We are really eager to partner with you. Our intention is to modify and improve the metric based on the feedback you share with us throughout this pilot. And so as CCOs who agreed to participate in this pilot, we are really depending on your input, what works, what doesn't work, what needs to be more clear, what additional tools would be beneficial. We really hope that you'll share that feedback, those questions, those concerns today and via our remaining closeout survey and optional calls. And we find ourselves at the end of March in our third pilot webinar, leading to some closeout activities in April and a proposal of this metric to the Health Plan Quality Metrics Committee and Metrics and Scoring in late April and late May. Okay, now we're looking forward to diving into attestation components 3 and 4. So these are the third and fourth components of our attestation. In our last webinar, we covered 1 and 2. So component 3 is really focused on CCO-led cross-sector community engagement. And component 4 is focused on developing an action plan. So how the CCO will improve social emotional health service capacity and access. As with our last webinar, we'll be reviewing the metric components as currently drafted, and then we'll collect some of your feedback via polls. Specifically, we're looking for feedback on, how are you interpreting items? Do you have the information needed to respond to the questions? Does each item gather the information we're trying to collect? And what questions or concerns do you have? All right, so attestation component 3. The objective of component 3 is to assess that you have meaningfully engaged cross-sector community partners, including Family Voice, to review the social emotional health reach data, the asset map, and discuss opportunities to improving social emotional health services. So the specific elements in this component are really aimed at using data meaningfully to engage partners, engaging a breadth of community stakeholders who all have a shared interest, as well as capacity and resources that could be leveraged to improve children's social emotional health, and to drive meaningful engagement of families and communities who have been historically marginalized as a result of racism and other systemic bias, to help identify service and access gaps and prioritize areas for improvement. Just some notes on the community engagement activities included. Community engagement is a critical strategy for not only achieving collective impact, but also supporting Oregon's health equity goals. So on the right, I've just inserted here our state's health equity definition. And you can see there's a specific calling out that achieving health equity requires ongoing collaboration of all regions and sectors of the state in order to create a health system in which all people can reach their full potential, their full health potential and well-being. And so if that's our goal, we know that engaging community and partnering with community is really crucial. When we get to our list of cross-sector partners who we're proposing you engage with, we just want you to know that this list has really been identified and prioritized based on all of our stakeholder input and learnings from the improvement pilots. When we get to our lists of communities who have been historically marginalized, we want you to know that that list is supported by well-documented research as well as input from stakeholders. And then finally, we want to convey that there will be regional variation in the breadth of partners and community voices to engage. And so as often as possible, we've included other options that allow you to write in additional partners or additional groups who you would engage based on your community context. All right, so here are the four elements of this component 3. First, we're asking CCOs to engage a breadth of cross-sector community partners to look at the data, to review and discuss the asset map, and to talk about barriers and opportunities. And so we'll share in just a moment a list of those proposed partners. That list is divided up into must include partners and then additional partners. So for the must include, CCOs would say yes or no that they've engaged all those partners. And then for the additional partners, the CCO would indicate from a drop-down menu which of those partners they've engaged. The second element is looking at how the CCO is engaging communities who've been historically marginalized to, again, review the data, inform the asset map, talk about barriers and opportunities. So similarly, in a few slides, we'll share a list of who we're proposing are those historically marginalized communities informed by evidence and research and data in Oregon. And so in year 1, CCOs would select at least one of those groups to engage. In year 2, you would select at least 2. And then in year 3, you would engage all 3 of those groups. The third element of this component is to select the strategies that you're using to obtain input from those groups that you indicated in 3.2 above. Again, we're offering you a list of proposed strategies you could consider for how to go about engaging those groups, informed by all of our learnings and stakeholder input. And that's a starting place that you can use. And then there's an optional fourth element of just submitting a summary of reflections. So as you've engaged all of these partners in your region and heard their perspective on the data, on the asset map, on barriers and opportunities, kind of what's that summary of their input? Now that's not a requirement, that's an optional piece. Okay, getting into our proposed partners for cross-sector community engagement. So this list has really been honed in on and supported by improvement pilots, as well as data and stakeholder input. So for the must include partners, these are the folks who we've seen in regions in Oregon when a community is working on improving social emotional health services. These are the folks who absolutely have to be at the table. Primary care practices, behavioral health practices, the early learning hub or hubs in your CCO region, tribal governments or the urban Indian health programs, and regional education service districts. So for those of you who don't know, ESDs house a program called Early Intervention and Early Childhood Special Education, which serves kids birth to 5 who are experiencing developmental delays and disabilities. And so they're a crucial partner. We have 2 other lists of partners who we're asking CCOs to choose at least a couple to engage. So this middle group, partners providing services aligned with social complexity indicators. If you remember when we dove into the REACH metric data, you'll recall that OHA provided that data by social complexity. And so you could see for your CCO region how many kids who have a parent who's incarcerated, how many of them are getting behavioral health assessments and services, or for children who are engaged in the child welfare system, how many are receiving assessments or services. So what we're asking you to do is engage at least 2 of the partners who provide services that are really aligned with those social complexity factors. And that's because we know that those indicators are really tied to a likelihood that children would benefit from some social emotional health support. So those might include culturally specific organizations in your region, local Department of Human Service programs, other behavioral health programs, criminal justice agencies, and others, again, to offer the flexibility for your region. And then the third set of partners are additional partners in your region who are interacting with kids birth to age 5. So that might include preschool or childcare programs, local public health programs like WIC or home visiting, regional health equity coalitions, faith-based organizations, and others. So this is a long list of partners, and we know that in order for this metric to be feasible, we could not require you to engage all of them. And so we've tried to be really thoughtful about who are partners who must be at the table, and then where do we want to see some representation, but allow for some flexibility as well. We want to pause there and collect a little bit of input at this point. And so I'm going to pull up our first poll asking that only CCOs who are enrolled in this pilot respond. I'm going to go ahead and launch the poll. So this first question looks at, does your CCO already have relationships with these cross-sector community partners that you could leverage for this work? And are there existing meetings? So as you think about ways that you're already engaging with some of these partners, are there advisory councils, cross-sector work groups, other meetings where you could share and discuss the REACH data, the asset map, and barriers and opportunities, thinking about what you already have in place that could be built on. So I'm going to go ahead and launch the poll and let folks take a moment to respond. All right, I'm seeing some responses come in. I'll give it another 30 seconds. Okay, great. We've had 14 responses. So I'm going to go ahead and end the poll and share results. So to this first question, does your CCO already have relationships with these community partners that you could leverage? Nobody said none of the partners, which is fantastic. I'm glad to hear that. 3 folks said, yes, we already have relationships with some of these partners. 10 respondents said, yeah, we already have relationships with many of these partners. And then one respondent said that they have relationships with all the partners on that list. So this is really exciting to see, and I just think speaks to how this community engagement component and the required activities can really build on a lot of the relationships that CCOs have invested a great deal of time and energy into building. And leverage that to have conversations specifically about young children and their social emotional health. And then that second question, are there existing meetings you can think of you're already convening or attending where you could share and discuss the data, the asset maps, barriers, and opportunities? All respondents said yes. And so again, I think this is really exciting for us to see that there are opportunities to leverage work that you're already doing to meet the requirements for this component. Okay. Super helpful. Thank you for your input. I'm going to close that out and move us on. Okay. Oops. Get us back to where we are. All right. So as you saw in the overview, another really important component of this set of community engagement activities is engaging with historically marginalized communities. And so we wanted to take a moment to specifically outline what we mean by this requirement. And so there is strong and extensive research, as well as data in Oregon, that really demonstrates that historically, children and families belonging to specific identities and groups have been marginalized, have been harmed, and have been neglected by some of the systems and services intended to serve them. And so if our goal is to reduce disparities in health and learning outcomes for young children and improve social emotional health and well-being, it's really important that we specifically prioritize the needs of historically marginalized families and communities. And so when we look at who are the communities in Oregon who have faced some of this historical marginalization, these three groups really emerged at the top. So first, families that identify as Black, Indigenous, and people of color, or BIPOC. Second is families who are experiencing social challenges, including poverty, substance use disorder, mental illness, child welfare involvement, parental incarceration, parental disability or death, or language access barriers. So I do want to say that disparities in these risk factors, they're the result of systemic bias, not the result of the individual failing of families, but they're really important indicators to pay attention to. And so through the social complexity data, we have a really awesome opportunity to look at who are those families and how do we offer them support that is best suited to meet their needs. And then the third group, as we think about, there might, depending on the community history or context, there might be other groups who are historically marginalized. One example, especially that we've heard about in this birth to 5 space, is families who are living in geographically isolated areas of a region, or who face really significant access barriers to services like transportation barriers. That's one theme that's emerged over and over again in our stakeholder engagement. And so we wanted to really specifically call out that group as well. And so what CCOs will attest to doing is engaging in the first year, at least one group. So when we say at least one group, we mean families, providers, or advocacy groups that reflect that group. So it may be that you want to engage BIPOC families, or you have a mechanism already to engage BIPOC families, or it may be that some of the partners you bring to the table are advocacy groups that represent a specific community. So in year one, just one of those groups. In year two, at least two. And then in year three, we really want to see engagement of families, providers, or advocacy groups representing all three of these groups. This is the kind of phased approach that we're hoping will really build capacity for deep and meaningful engagement of historically marginalized communities in this work. And then we're also asking, when CCOs select which communities they're engaging, that you also let us know which strategies you're using to engage those communities. So we have learned through improvement pilots and through stakeholder engagement, and also just looking at kind of public health strategies, what are really helpful ways to think about engaging family voice. And so we're offering a starting place of engagement strategies and just asking that CCOs select which of these strategies they're using. There's no minimum requirement. We're not trying to push you to use all of these strategies, but really point in the direction of engagement strategies that will really result in meaningful input. And so you can see those examples here. One option is to review existing data that's already been collected in your CCO region about families' experience accessing social emotional health services. I'll tell you, maybe your early learning partners might be really helpful in this realm because they've done quite a few family listening sessions already, and this topic might have emerged. Another option would be to partner with and pay parent or family representatives from historically marginalized communities to sit on your advisory councils or to attend your meetings. You can also include providers and these advocacy groups in partner meetings that you're convening. The CCO can attend meetings that are hosted by families, providers, or groups. I'm thinking of, for example, the CCO's Community Advisory Council or the Early Learning Hub Parent Advisory Council. These are councils where parents and families are already sitting and coming together and discussing their needs and priorities. And so the CCO could choose to listen in on those conversations to learn from family perspective. Another option would be to partner to specifically collect new data. So maybe convene additional focus groups or listening sessions. And then of course, we know there may be some other strategies that are creative and that you can think about in partnership with your community partners to engage those voices. And as a reminder here, we're just looking for CCOs to select which strategies they're using with no minimum requirement. Okay, so we have another set of poll questions. After talking through this portion of component 3, really focused on engaging historically marginalized communities, we're really anxious to hear and learn from you. Are there ways that you're currently operationalizing or measuring your engagement with historically marginalized communities, whether for CCO 2.0 requirements to meet those requirements or for other reasons in other ways? Does your CCO already partner with families, providers, and advocacy groups that represent these communities? And are you aware of family engagement activities that have been or are currently being conducted in your region related to children's social emotional health or kindergarten readiness that you could leverage? I am going to go ahead and open up the second poll. All right, looking forward to hearing this input. I've got 10 respondents. We'll wait another 30 seconds. We're hovering at 13. We got 14 last time. Last call. Okay, I'm gonna end the poll and share results. All right, let's see. So are there ways your CCO currently operationalizes or measures engagement with historically marginalized communities? 8 of you said yes. Nobody said no. And 5 respondents said, I don't know. So for those of you who said yes, we would love to hear and learn a little bit more. And specifically, if there are ways that we could align our requirements and our ways of collecting this data with what you're already doing, how you're already measuring that engagement. So if anybody wants to unmute now and share thoughts or put them in the chat, and if not, follow up via email with our team. We would really love to hear those insights. I'll pause for a moment to see if we have any brave souls who want to unmute and speak out into the group.
I'll mention something, Elena. This is
Peg.
Hi,
Peg.
Hi, how are you? I feel like I'm not sure we measure it. That's what I'm really interested in. Is anyone actually measuring it, and how? I feel like we have operationalized it in different ways through our equity and engagement team and through some COVID impact support funds that we gave to culturally specific community-based organizations in December. So we have there were 60 organizations that we gave that money, 4.7 million to for COVID response. And our intention in that engagement with those 60 organizations, they're all BIPOC. We are tracking that and now sort of having, regular webinar engagements with them. So I don't know that we're measuring it, but we're kind of moving in that direction. I'd be curious to hear more if you had suggestions on measurement.
That's super helpful to hear, Peg, and I think a great example of how you can think about what are the ways we've already been engaging with, BIPOC organizations that could also be leveraged for this work. I don't think our team has specific thoughts beyond what we're sharing today about how to measure. I think how we've thought about it is, as I've just described, and thinking about, okay, if we were to elevate 3 different groups of historically marginalized communities, how could we ask CCOs to kind of progressively deepen their engagement across those groups? And so if there are, other ways that folks are measuring, what I'm hearing from you is one helpful way that HealthShare is thinking about engagement is how are you financially supporting those organizations? So financial support could be one kind of measure, which is helpful to be aware of. But are there other examples from anyone else, other CCOs?
This is Tanvir from
Hi, Tanvir.
Hi. So, I would say from a measurement perspective, before CCO 2.0 contract period started, we did represent on our board from our tribal government in Douglas County, that would be the Cow Creek tribal government. And now we do. And the big success for us, we also have a board level health equity committee where we have a co-chair from the tribal government also. So we are progressing. And what we hear from the other side is that they have a voice now, which they didn't have before. And I did all of that to CCO 2.0. Unfortunately, we don't get any credit, but that's fine. We are happy. This,
Yeah, thank you for sharing that example. I think what's really important and difficult, but also a big opportunity about community engagement is it takes multiple years to really have deep and meaningful engagement with community partners. And so I think it is really great to hear how many CCOs have already done a lot of that partnership development and have a strong foundation to build on. And so what I'm hearing for UHA is that one way you think about kind of engagement with historically marginalized communities is membership on some of your kind of councils or boards, which would absolutely, be something that you could count toward meeting this engagement requirement. That's helpful to hear. How about anybody else?
Which I guess, Tanvir, when you mentioned the issue of don't get credit, I actually want to just highlight that's partially why we want to put this type of activity as something that you would attest to that is then tied to incentive dollars, because to your point, it takes work and it's really thoughtful and important work that requires staff and resources that I think is the purpose of transformational funds, is to transform the system. And so if we know that there's like this deep commitment to health equity, and we know that in order to address these gaps, we actually need to learn from the people. This is part of the reason we wanted to really honor the system level work that needs to happen before we jump to the person level metric, because we want to make sure that it is really informed by the community and that the incentive dollars that you would get by doing this really critical work support that meaningful work in a way that kind of propels us forward and is informed in a way that it propels us forward. Where I think often when you get, it's part of the strategy of not starting just at the person level metric, because then what you quickly do is you figure out how to improve the numbers, right? Which actually sometimes disincentivizes you from thinking about these marginalized populations. So I really appreciate actually the comment, and also want to highlight for others the intentionality of kind of giving legs to some of the CCO 2.0 requirements with a focus on children and with a focus on populations for whom this inequitable start is more likely to have them also start school in an equitably different position. And we know that education is like one of the most foundational social determinants of health. So it's fun to kind of see between Peg's comments and Tanvir's comments, this dot connection, a little bit of what was some of the strategy behind this metric and why it should sit in an incentive metric set in terms of providing transformational funds for that work.
Yes, Colleen, agree with what you said 100%. And the thing is, the community has realized that there was a pre-CCO 2.0 and there's a post and the present period of CCO 2.0. The framework itself was very transformational. That was given to the CCOs as a challenge to adopt. And I think if that framework didn't come from OHA, things would not have changed. And that's the impression the community had. That's what I meant, really. I was indirectly giving more credit to the policymakers who came up with the framework for CCO 2.0. There are really great things in it. And Oregon is being considered as a model for the whole nation right now on Medicaid.
Yeah. And Elaine, I just want to call out that Susan put in a comment about the comments resonate with her experiences at All Care and kind of their process of developing a community engagement tracking process that helps illuminate kind of this opportunities of like setting the table versus joining the table. And she outlined a number of really important work groups that I think are represented. I think we have them all represented, but I think it's great feedback, Susan, for making sure that we put them into some of the guides. Susan, is there anything you want to add? Thank you for the comment in the chat.
No, the one piece that comes up for me is it's one thing to measure, the quantitative pieces of how many meetings and what level and what was the focus and what populations did, were represented and were the voices centered. But I hope that in all of this, we also really almost develop a consumer satisfaction, right? A feedback loop from those entities.
Yeah.
Mhm.
Because we could be thinking as CCOs that we're on the right track. But I would really love for us to be held accountable to check in with those partners to get their feedback and guidance.
That
Thanks for
resonates.
highlighting. Yeah, that really resonates, Susan. And I think you'll see something in component 4 that really speaks to that, of how we're rounding back with these partners and community organizations and families to say, okay, in subsequent years of this measure, how did we do on our action plan? Help us evaluate our successes and our areas of continued improvement, and help us improve the action plan for future years. Because I do think that's a part of, what meaningful community engagement is it's a sustained relationship, not a one-time, we want your input at this one meeting. And so thinking about ways we can build in mechanisms that support that are really important to our team. Well, I'm going to move us along to the other questions in this poll, just so that we can make sure to get through all of our components. So the second question was looking at, does your CCO already partner with families, providers, and advocacy groups who represent these marginalized communities? So 9 respondents said some of them, and 4 respondents said many of them. So we didn't have any folks who said none or all. But again, I think there's really strong foundational work that CCOs are already doing. And it's great to see that reflected in the poll here. And the third question was looking at, are you aware of family engagement activities conducted in your region around this topic of children's social emotional health and kindergarten readiness that you could leverage? So to that point of, what are your strategies for engaging families and community voice? Are you aware of what work might be already happening in your region? So 11 respondents said yes, and 2 said no. And one thing we're trying to gauge with this question is, are there additional resources or, materials or tools that our team could point you in the direction of, where if you're not aware, we could perhaps create a compendium of like, here are all of the recent regional listening sessions that's happened with families birth to age 5 across Oregon. And maybe your CCO could reference those and see, okay, have any been conducted in our region, and what could we learn from those as a starting place, and who were the partners and families engaged, so that we know kind of some of the initial foundational work that's happened in our region. So this is really helpful information for our team to be hearing. And to that end, let me figure out how to stop sharing this poll. Okay, there we go. To that end, we did want to ask, kind of open up for discussion, whether there are additional tools or resources that would help you to engage meaningfully with cross-sector community partners, or just other considerations that you feel like we should incorporate into this component 3 of the attestation. So please feel free to unmute or share in the chat any reflections or thoughts you have.
Alina, I had a question. This is Peg again. If there are more than one CCO, in the region, is there consideration about working together, so you're not like overtaxing the community-based organizations?
That's a really great point. Yeah. I think that's a really important consideration, especially as there are more and more regions in our state that have some overlap of CCOs. And so, yeah, I think it's something that we could think a little bit more about. We perhaps want to dedicate a little bit more time to thinking about how the attestation can specifically call out that coordination piece. If you're if you overlap with another CCO, how we could specifically encourage you to coordinate and kind of count, make sure that we're not incentivizing a duplication of efforts. Do other folks have thoughts on that? I'm curious for any CCOs that do overlap with other CCO regions, like how have you managed that, if at all, up until this point? What lessons might you have for us about engaging with a lot of these different partners?
Alina, it's Susan. I think that there's been such a good precedent set by our need to do collaborative community health improvement plans and the relationships that we've formed there. For All Care, we'd be overlapping with 3 other partner CCOs. And I think that, the word encouraging struck me. I just think maybe a stronger word being built into this is warranted, given what our communities need. If this truly is going to be a community-centered metric that moves our children and families forward, that using a stronger word than encouraging us to work together is going to be important.
Thanks, Susan. So for the requirement around community health assessments and improvement planning, is that currently our CCOs that have overlap with other CCOs, are they currently required to do that in partnership? Or is that an area where you've learned like actually stronger language would be really valuable?
I will let my peers correct me if I'm wrong. I believe that it is required, and beyond that, we need to pull in our local public health authority, hospital systems, and federally qualified health centers. So I think that this exercise of working across sectors and delivery models is going to feel very familiar to many of our teams.
Yeah, I believe it is required also. And I'm also thinking of like system of care, where the 2 CCOs are required to have one system of care. So I think I just worry about the burden on these communities that we're trying to uplift if everyone's just reaching out to them.
Yeah, absolutely. Thank you for calling that out and for your insights about where there's precedent around requiring coordination across multiple CCOs that we could really build on. That's great. Other thoughts, questions, reactions? I can't see if there are questions coming in the chat. Let's see.
You're okay. They're talking about the kind of cross-sector engagement. I'm watching it like a hawk for you, Alina.
Thank you. Awesome. Yes. Okay. Yeah, if there are other reflections that folks have that they want to put in the chat, or even just send in a follow-up email with our team, or include as a comment in closeout survey, we really encourage that, because we do want to build on and align with what you're already doing, because it sounds like just from some of the feedback shared today, like there is some really extensive and intentional community engagement work happening, and we really want to honor that and support that and think about how this metric could build on that. Okay, I'm going to move us into our 4th and final attestation component. So the purpose of this 4th component, we're looking to assess that your CCO has developed an action plan that addresses capacity and access gaps for social emotional health services. And that this action plan has been informed by all of the activities in components 1 through 3. So the review of the REACH metric data, the asset mapping, and the engagement of your community partners. So here the phased approach across the 3 years would look like in year 1, CCOs using the REACH metric data, asset map, and community conversations to take a first pass at crafting an action plan. So identifying target areas for improvement, strategies, and progress milestones. And then in years 2 through 3, we would ask that CCOs assess their progress. So how did they do on that action plan? Did they make progress on those milestones they set? Do you see any movement in the social emotional health reach data to assess whether the action plan targets and strategies resulted in any improvements? And then adjusting the action plan accordingly with input from those community partners. So to Susan's point about feedback loop, and really continuing that engagement of partners in the long-term process of improving access within the community. So here are the 4 elements. Again, 4.1, 4.2, and 4.3 would all happen in year 1. That's selecting target areas. We'll share a list of proposed target areas that you can start with for consideration on the next slide. And we're asking that you select at least 2 of those target areas, knowing that those are the areas that we heard extensively from stakeholders and that we saw in our improvement pilots really galvanize effectively work to build capacity in terms of social emotional health services. And then attesting yes, no to whether you included input from historically marginalized communities in that action plan development. And attesting to attaching or uploading your action plan. So that would include the target areas you selected and the improvement strategies and milestones that you're setting. And then 4.4, you can see this is the requirement for years 2 through 3, where you would assess whether you made progress on your action plan. You would engage communities to evaluate and help revise the action plan. And then you would again attach or upload the plan to the survey tool that this attestation would be collected using. So these are the proposed target areas for your action plan, which we're offering as a starting place for your consideration, knowing that our team had, through doing this work, through reading, through listening to other national work on improving social emotional health services, we're really confident that these target areas will support CCOs to build their capacity for providing social emotional health services. When we collected a survey from over 700 folks across Oregon, the majority of whom were early learning providers and healthcare providers serving young kids, they pointed to barriers in these target areas and said, well, if only we could address, workforce and contract barriers, then we know we'd be able to improve social emotional health services. Or if only we did a better job improving care coordination. So we wanted to offer these as the starting place because we're really confident that these will kind of lead you to some really meaningful work that will help you see improvements in your capacity and access for families. So those target areas include workforce development, so specifically with the focus on improving skills of available providers, whether it's through training, support for credentialing, providing tools and training on tools. There's workforce development with a focus on increasing provider diversity and availability. So that might look like unique recruitment strategies, perhaps. You can think about increasing the range of social emotional health service modalities that you provide. So if we think back to the asset map that OPIP shared in our last webinar, and specifically the tool around the list of behavioral health service modalities for children birth to age 5, It might be that your CCO currently has 2 of those modalities available in the region, and that stakeholders and community partners have said, you know what, if we could add a couple additional modalities, that would really go a long way to improving access or engaging families who might benefit from social emotional health services, but not feel like the current modalities we have would really meet their needs. So that might be an area of focus. You could look at addressing access barriers for families, specifically whether that's language access supports, childcare, transportation. One thing we heard a lot from families is the importance of expanded hours or even flexible scheduling. You could also think about care coordination. So thinking about this really awesome asset that we have of peer navigators or community health workers or social workers who could be leveraged to support families in navigating social emotional health services or referral pathways. Another area would be addressing contractor payment barriers for existing social emotional health providers, or pursuing new contract and payment options for community-based services that support social emotional health. And then we've also heard this again and again from stakeholders, just the importance and the opportunity for public health messaging to increase awareness about what social emotional health is, what services are available, and to reduce the stigma that exists often in communities around accessing social emotional health services. And then we have another option, because we know that your community partners might have great ideas that aren't reflected here, and we want to honor that and support innovative work. So again, just as a reminder, the CCO would select at least of these 2 target areas. And then for each of the areas, you would detail what your specific strategies are and what milestones you would set to show that, or to indicate that you were making progress in this area. All right, our last poll. Here we're really curious about your input on this 4th component. So do you already have improvement efforts specific to children planned for the statewide PIP focused on behavioral health? Do you have improvement efforts planned to meet CCO 2.0 requirements related to access and provision of behavioral health services for children? And does your CCO already have processes or templates in place that you use for developing strategies and selecting or writing milestones that we could align with for our action plan, knowing that CCOs do a lot of improvement work, and we would love to leverage and build on what you're already using that works well for you. So let me open up this 3rd poll and go ahead and launch it. Okay, great. We're about halfway there. Okay. Gonna give a few more seconds. Great, let's take a look. Okay, So in response to whether you already have improvement efforts specific to children planned for the statewide behavioral health PIP, 2 CCOs said yes, 4 said no, and 8 said I don't know. So if you responded yes, we would love to hear if you are open to sharing with us which CCO you are, and we would love to learn like what those improvement strategies are, how we could align and leverage that work so that you're not duplicating your efforts. That would be fantastic. Feel free to write in the chat or unmute. And then for those of you who said, I don't know, feel free to, actually, I'm not sure there's any follow-up that would be helpful in that group. It's just helpful to know kind of for this set of stakeholders who's listening in on the webinar and weighing in how much info folks have about their planned behavioral health strategies. So for the second question, do you have improvement efforts planned to meet CCO 2.0 requirements around access to and provision of behavioral health services for kids? 8 CCOs said yes, 0 said no, and then 6 said, I don't know. So again, if you responded yes, and if you had specific feedback about, okay, knowing what those improvement efforts might look like, what work you have planned to meet CCO 2.0 requirements, is there anything you want to put on our radar for inclusion in the metric that would really help you align and build on work that you already have planned? Feel free again to share via chat or in an email. Or even in a closeout call with our team. Waiting a few seconds to see if anybody wants to speak up. Okay. And then the third question was looking at, does your CCO already have processes or templates for developing action plans, strategies, and milestones? 4 of you said yes, 3 said no, and 7 said I don't know. I'm really curious about this one in particular, and if, you know, right now we've only offered potential target areas as a starting place. We're not requiring a specific template or format for you to submit your strategies and milestones. Because we want to allow for that flexibility and for CCOs to submit in a format that really works for them. But if you have something that your CCO uses that you think would really be helpful and that other CCOs might benefit from as they do their action planning, please do share that with our team. It would be amazing to know what resources and expertise have already been built out there. Okay, I'm gonna stop sharing that result, close the screen, and then open it up more broadly to hearing if there are other, you know, thinking about this component around action planning. Are there other tools or resources that would support you here, or any additional considerations you want us to incorporate related to this fourth and final component of the attestation?
Hi, this is Jean from EOCCO.
Hi, Jean.
One of the things that the public awareness, I think that would be a resource that you could help all the CCOs instead of each CCO doing something or doing it with public health. You know, right now public health is pretty taxed, and they will for a while. So asking them to do anything else right now is kind of rude. And so I could see, you know, that you guys could start a statewide public awareness campaign around the stigma and around early childhood mental health, and asking CCOs who would like to contribute to this awareness campaign. So it hits the entire state, not just pockets of counties. And I think that way our dollars could go a lot further, because it's not inexpensive. Well, depending on what you do, but if you really do a good campaign and you go to really change or to make awareness, it's not a brochure or something in the mail. It really has to hit and be big. And that's how we could, expand the dollars that are available, in my feeling. And Arimha was also interested in that and joining efforts. But again, they didn't have the funds to just do it on their own. So there's organizations, early childhood organizations, that are really eager to partner.
Yeah,
So I
thank
think what,
you.
yeah,
Go
John,
ahead.
so I think I'm hearing a couple of things. Is one is, if in the community engagement, there's a shared across the CCO's agreement. So if this were to become a metric, I think on the first call, Andrea made a good point about, like, there's great efforts here. What are some of the corollary activities that could happen at a state level to support the community level efforts? And Andrea had mentioned, some of the coverage issues that I think were really helpful, that if this were to become a metric, that it could galvanize enough political steam to support that work. I hear what you're saying, John, is that if the CCOs in their engagement hear from the communities shared this public health messaging, and that identifies that as an action plan, that's something, as we're thinking about sharing with our OHA partners who are collaborators on this effort, about the value of what kinds of general supports they can provide statewide to CCOs and improvement, that this could potentially be a good opportunity. As you know, the Transformation Center provides a number of cross-cutting supports for once a metric is a metric, to support CCOs together. And so thinking about ways within that community level engagement and the others that we could get enough sense, if this were to become an incentive metric, that there was shared priority across the CCOs, then ways, as you know, that then trickles other parts within the state level effort. And it's really helpful to hear from you about some current partners that are already thoughtful and engaged that this could help kind of align with. So I think there's two parts of that we could make sure that we illuminate. One is making sure that we could capture that if this were an incentive metric, that all the CCOs could be able to give that information. The second is, I think we can add this to our list of topics that I think we've been gathering, of kind of the parallel complementary activities that need to happen at a state level. And then the third is, as we've been documenting what kinds of tool supports, technical assistance will likely be needed, like have been provided for every other incentive metric that has been put onto the incentive metric list. I think we can raise this as something as an opportunity for the Transformation Center, given that's their role, is to support the implementation and improvement on incentive measures. So thank you. I think there's three different ways we can take that feedback and try to put it into the right appropriate places.
Kind of related to that point, I just had a question about, I meet with several of the people on the phone occasionally, on this meeting occasionally, but it seems like there'd be a great opportunity for some kind of learning collaborative as we try different things and as we learn from each other. So I don't know if that is something that the Transformation Center or OHA could provide. I think there'd be great opportunity in learning from each other and spreading what works.
Yeah, like in these really novel transformative metrics, like the value of you all learning with each other. And thankfully, the way it's designed is you want to each be successful in that way. So I think that's really good feedback, Peg, that we can also add to that list in terms of tools and supports, and also recognizing, particularly for developmental new metrics, this kind of new way we're wading into things. Thank you.
Yeah, and I noticed Susan had a question, how I see Help Me Grow fitting into this. I see it totally fitting into this. I see it as a, we're funding community health workers that speak different languages in the 3 counties that are Help Me Grow liaisons that are connecting families to social emotional support. So I think it's directly related to this.
it makes me so excited to hear so many of the partners on the call. It feels like there's still a bit to be done with this measure and moving it into reality, but there's so much that we've all been working on and so much commonality across the state. I love the idea of a professional learning community. And then from Help Me Grow, my mind kind of, that PLC potentially could also look at how community information exchange could leverage some of these efforts forward.
Yeah, that's a great point with Connect Oregon rolling out in many parts of the state. And Help Me Grow will have an elevated status within that platform. So it will be sort of the early childhood arm, at least in the metro region.
It's exciting to hear these connections and just the ways that folks are thinking about implementation and what ways you could be learning and building on what your respective CCOs have been doing. And so, yeah, to, just echo Colleen, it's something we'll really elevate to our list of what kinds of implementation supports would be valuable, and how can we start to think about what gets put in place around that. Okay, well, we have just a few more slides to cover, and I want to make sure that I get folks out of here on time so that you can enjoy the beautiful weather this afternoon.
I wanted to just put one point. I think we all know that the point of this is to make synergistic dot connections and to try to galvanize implementation. And for many of you on the phone call, the reason I know your name is we've been talking about this for 7 years, right? And so I really take to heart, Susan, this kind of comment about what it takes to actually put things into motion. I want to kind of just further make the dot connection. That is partially why Health Aspects of Kindergarten Readiness recommended that all the levers that exist, and there are many, that is partially why there is the value of trying to think about this within the incentive metric. Because what we know is what is measured is what is improved, and we also know what is incentivized gets an enhanced focus, both from a state level and from a community level. So I think that's actually, again, many of you were involved in Health Aspects of Kindergarten Readiness or filled out all those surveys. So I hope that that's kind of part of that dot connection of why we're kind of at this point to try to actually put a transformative measure that is within a program that has additional sets of resources that can help galvanize additional action that obviously needs to be synergistic and aligned with it, because this kind of work, if it was just sitting in a metric alone, wouldn't work. And so what we know from since 2013, when we look at other measures and transformative activities that have led, is when we use this opportunity to use this lever, which is limited, there's only a certain number of measures that get into that set, that it does give this opportunity to propel forward a number of these threads. And it also does give the opportunity at a community level, but also at a state level, to increase and enhance focus on it, because it's one of those areas that's a priority focus from a measurement point of view.
Yeah, thanks, Colleen.
All right.
Okay. So the last thing we really wanted to take the opportunity to discuss for a few minutes with you all is just kind of reflecting on our design parameters for this metric, and then thinking about some of our key considerations around scoring. So from the beginning of our work to develop the measure, we settled on some design parameters that would really help us be intentional about what activities get included in this system level metric. So we wanted to be sure to capture a variety of components that really are operating at that system level, and that also leverage the person level data, thinking about that reach metric data. We want to look at filling some gaps, addressing some gaps in the current incentive measure set. We want to think about the continuum of services and support. So I think this is something that many of you have raised in conversations through this pilot and over the years, is that all children need support around their social emotional health and development, whether that looks like promotion and prevention or whether it looks like intervention and treatment. And so how can this measure really be supporting and galvanizing work across that continuum of social emotional health services and supports as we think about kindergarten readiness? We also looked at activities that really address integration and cross-sector collaboration and community engagement. We know we would need to limit the number of components and prioritize what's most essential, and then really ensure that there's a focus on health equity. And so, really reflecting on those kind of carries us forward to thinking about how we want to consider our scoring approach. So there are many considerations we've been weighing with how to score the attestation. And specifically, these are things our development team has been considering, really looking at the overall number of items in the attestation to ensure feasibility, thinking about how we're balancing our yes/no items with items that require additional information or supplemental materials. I think you'll see that in the kind of overview of each of the different components. Thinking about, looking overall at all 4 components, how to kind of weigh components 2 and 3 a little bit more heavily. So some of the requirements in those components would take a little bit more time and energy, because we know those are the activities that will most support CCO's building capacity for providing social emotional health services. We're thinking a lot about creating a framework for scoring that doesn't advantage or penalize CCOs based on their size or their networks. And then in the spirit of continued learning, knowing this is a developmental new metric, trying to support really transformational work, but brand new work, how could we ensure continued learning? And so we've created these kind of optional reflection items that would allow for OHA and other partners to just stay up to date on how we can continue to refine the tool and the measure. So these are things we've been considering, and we're also so curious about your perspective and thought partnership on these considerations. So we just wanted to put these out there so that you can be thinking about what feedback, what questions, what concerns you might have about scoring to offer via our closeout survey or calls. We'll be sure to include some questions and feedback opportunities specifically around scoring. Just wanted to share that. Then the last note we have is just about documentation. So the attestation tool in many areas, it doesn't require submission of evidence about the activities. You, the CCO, would attest yes or no, we did this, we didn't. Beyond, of course, uploading your action plan in component 4. And we just wanted to be clear and transparent that OHA may choose to audit CCOs on this metric, in which case submission of evidence might be required for CCOs who would get audited. So examples of evidence might include, who are the members on your advisory councils or work groups that have been engaged on this topic, so membership rosters, meeting dates or agendas or notes that have been focused on this topic of social emotional health, family engagement reports or findings. So there are lots of different examples of what evidence you might include, but just wanted to be clear from the beginning that even though the attestation tool might not require you to submit this kind of evidence, just to have on your radar that should OHA choose to audit, that would be important to have on hand. And then just wanted to say a word on closing out this pilot. It has been so valuable and such an honor to hear your thoughts and input, and we really appreciate that. And wanted to put in one more plug that, as CCOs who agreed to participate in this pilot, we really are depending on your input and your collaboration. We want to make this a meaningful and a feasible metric that continues to galvanize the statewide momentum on supporting children's social emotional health. So we really do hope that you feel comfortable to share your feedback, your questions, and your concerns with us. We have a few opportunities to do that. Our closeout survey, you can feel free to just send us a kind of out of the blue email at any time, or through optional individual closeout calls. So we've heard from one or two of you around scheduling those, but if others are interested, please reach out to me. My email address is right here to schedule so that we can get those on the calendar and hear your input as we refine this metric for proposal. Any other words, OPIP? All right. Well, really appreciate everyone's time and energy. Thank you so, so much.
Thank you.
Thanks, everybody.
Thank you.